Hello everyone, my name is Astrid Hernandez, and this presentation I decided to do it on a type of irritable bowel disease, which is known as Crohn's disease. And really quickly, I just wanted to say that the reason why I specifically chose to focus on Crohn's disease for this presentation is that not enough research has been done on how it affects people or why the disease manifests or develops. And so I feel that it's very important to bring a little bit more awareness about what Crohn's disease is, and hopefully in the future more research can be done so that we can better understand this disease and how to treat it better. Okay, so what is Crohn's disease, also known as CD? As I mentioned before, Crohn's disease is a chronic irritable bowel disease that manifests chronic inflammation throughout the gastrointestinal tract. Specifically, the chronic inflammation has the ability to impair the proper function of the gastrointestinal organs, making the disease identifiable at the organ level. So very briefly, for those of you that may not be aware of what the GI tract is, it is basically our digestive system, and it is made up of the mouth, the esophagus, the stomach, the small intestine, the large intestine, the anus, as well as the liver, pancreas, and the gallbladder. So Crohn's disease itself can affect any of the organs that make up the GI tract. However, it is known for it to most commonly affect the ileum. Moreover, it's possible for Crohn's disease to only affect one specific region of the GI tract. So this is why sometimes when patients are diagnosed with Crohn's disease, the disease itself only affects patches or different small parts of the GI tract, but it can also leave other parts of the GI tract unharmed. So, due to the disease impairing the proper function of the gastrointestinal organs, patients that suffer from Crohn's disease can experience sometimes severe symptoms of diarrhea, rectal bleeding, which can cause blood in the stool, abdominal pain, or also a form of cramps. You can also experience fatigue and weight loss, as well as vomiting and fever. So for this section, I came across some risk factors that are general for someone to develop irritable bowel disease and not just specifically Crohn's disease. So basically these risk factors can also apply to someone that may be at risk of developing ulcerative colitis. So as I listed right here, antibiotics can increase the risk of someone to develop irritable bowel disease. For the second point, appendicitis, I learned that if someone had their appendix removed during childhood, it can put them at an increased risk to develop a form of irritable bowel disease or even Crohn's disease. As for diet, certain foods, such as foods that are high in sugar, fat, or foods that are just processed meals in general, can also put someone at an increased risk to develop irritable bowel disease. Moreover, I also learned that these foods can trigger symptoms or cause flare-ups for people that already suffer from irritable bowel disease, such as Crohn's disease or ulcerative colitis as well. Another risk factor is nonsteroidal anti-inflammatory drugs, and examples of these types of drugs or medications that I know a lot of people commonly take for pain medication is aspirin and ibuprofen. Lastly, smoking is considered an environmental risk factor, and I learned that people that smoke are 2 times more likely at an increased risk to develop irritable bowel disease or specifically Crohn's disease. So, how does Crohn's disease impact the quality of life or the lifespan of the vulnerable populations? For starters, patients that suffer from IBD can have healthcare costs or medical bills that can go up to $23,000 per year, as opposed to non-IBD patients who usually spend on average $7,000 for medical or healthcare. Another way that Crohn's disease impacts the quality of life of people is that it is known as a chronic disease. So even though there are treatment options available, this condition cannot be cured. Moreover, women that already suffer from Crohn's disease have a negative impact on their quality of life in terms of when the disease is currently active in their bodies. This can affect their fertility. So if women are trying to become pregnant or when they have a flare-up of their Crohn's disease, this can actually affect their ability to conceive a child, which make getting pregnant difficult. For children that suffer with IBD or that have developed Crohn's disease, this disease can significantly affect their growth and even affect puberty as they continue to age and grow. As for people that are already living with Crohn's disease, sometimes the symptoms can be so severe that it impairs their ability to be able to work at their jobs. And so oftentimes for those that do have severe symptoms from Crohn's disease, they have to quit their jobs because they are unable to continue working because of their symptoms. Lastly, there is evidence that suggests that Crohn's disease can lead to a slightly higher mortality rate as opposed to people of the general population that are healthy and that do not suffer from Crohn's disease. So as I was doing my research, I came across a vulnerable population that is known as the Ashkenazi Jewish population. Based on the articles that I used to gather my research, I learned that the Ashkenazi Jewish population has a 2 to 4 times more prevalence of Crohn's disease compared to non-Jewish Europeans. In one of the other articles that I read, I also learned that this same population had a higher prevalence of Crohn's disease when it was compared to a cohort that consisted of African Americans and Hispanics. Very little research has been conducted on the Ashkenazi Jewish population, but I did gather enough information to learn that this population is disproportionately affected by Crohn's disease. So the main reason why the Ashkenazi Jewish population is more likely than other different populations to develop Crohn's disease has to do with genetics. In the year 2012, there was an article published of a study that was conducted that was a genome study, and it revealed that genetic markers that were discovered by the scientists made up approximately around 11% of a genetic variance for Crohn's disease in the Ashkenazi Jewish population. This study and the discovery was a major breakthrough to all the scientists/researchers involved because they were able to open the door to future studies as to what specifically in the genes of the Ashkenazi Jewish population causes the Crohn disease to manifest itself in the people, so that in the future there can be treatment options for this population. As you can see in this image, there are 5 graphs, and they are regional plots, and they are depicting the 5 associations to Crohn's disease that the scientists that conducted this study were able to identify in the Ashkenazi Jewish population.